you're welcome to another edition of Health Talk with Queen Nikki. Health Talk with Queen Nikki. Okay. That's my logo, right? Y'all know, right? Okay, you're welcome to another edition of my program. Have you subscribed to my YouTube channel? Run to YouTube, subscribe to my YouTube channel. The handle is called Health Talk Queen 1, Health Talk Queen 1, and on TikTok, Health Talk Queen. Okay, let's dive into today's topic. Today's topic, as usual, if you want to send me a topic that you want me to talk about, I go by most asked topic. And this week, the most asked topic is sickle cell crisis, management of sickle cell crisis. I had an email from a father that is very, very emotional, and he was asking me that how can he better manage our daughter's sickle cell. I already asked for permission before I can say that on here, and he said go ahead. I'm not going to mention his name, based on my profession. I just want to go straight, and I promised him that I'm going to be doing this video so he can watch it. So I'm going to emphasize on it. This video can be 2-part or 1-part, but I will try. I'm doing this video for those people who have sickle cell children out there, how they can manage their crisis. Like in all my program, I already mentioned it, that I'm not going to be going through pathophysiology, what is sickle cell, how we affect our organs and stuff like that. No, we're not going to do that. My purpose of this program that I'm doing is to advocate prevention and management of all this disease process that I'll be bringing. So stay tuned to my program. Make sure you subscribe to my YouTube so you can get all this yummy prevention free. Okay, so let's dive into it. We all know that sickle cell is one of the disease process that we really need to pay attention, especially for young couples out there that want to get married. Make sure you know your blood group before you do marriage and or propose to any girl. Make sure you know the blood group. Now, before I download this video, I'm going to put a chart. I have a chart where it will explain, like every disease process that I do, there is always a chart that will follow to explain what kind of blood group can marry which kind of blood group. You understand? So please watch out for that chart. I'm going to be bringing out those charts and other supporting charts too, so we can all understand. So we don't make that mistake, right? Especially for young couples out there that are getting married. Okay, so let's go. What are the trigger of sickle cell? What triggers sickle cell crisis? Number one, dehydration. Yes, dehydration. They don't drink enough water as a patient. They don't drink enough water, and if they don't, it's going to trigger their crisis. Okay, another one is cold weather. It's getting cold here in the United States. We see a lot of patients with sickle cell crisis coming to the ER, so temperature, and it can be hot weather too, but mostly cold weather. So it can be cold weather, it can be hot weather. Let's just say weather change can trigger sickle cell crisis too. Infection. If they have respiratory infection, especially during flu season, yeah, it can trigger their crisis. Stress, especially when if they are like of a working age, and they go to work, they're exhausted, they're tired, it can trigger their sickle cell crisis, which is pain. Yeah. If you have ever worked with a patient as a nurse, if you have ever worked with a patient with sickle cell crisis, you see how they cry. They are in excruciating pain. And for those nurses out there, if a patient said he or she is having pain, believe them. Even though this sickle cell patient, they might be on their phone and they will be telling you, oh, their pain is 10 out of 10, and you'll be like, okay, but you're on your phone, you're smiling. No, as our ethic, whatever patient pain rate the pain is, that is what we're going to believe it is. Okay, so just because they are smiling does not mean they are not in pain. We just have to treat it accordingly to our policies. Okay, so stress can be number one causes or trigger of sickle cell. Pregnancies, for those people that are sickle cell carrier or sickle cell patient, yeah, during pregnancy it can trigger their pain, it can trigger their muscle to be deteriorated, so yeah, pregnancy. Smoking, yeah, some sickle cell patients smoke or they don't eat right too, yeah, but it is what it is, so it can trigger it too. Vitamin deficiency, yeah, when they lack some certain vitamins in their body, it can trigger crisis for them too. Strenuous physical activity, let's say over exercising or over working or over doing stuff, like physical exhaustion, yeah, it can trigger their sickle cell crisis. Now let's go to prevention. I love that. Let's go to prevention. Let's go to how can we manage this crisis when it comes. Number one, when we say the trigger is warm compressor, right? Like warm environment, yeah. So now let's use, if it's warm or too cold, you want to use warm compressor. Now this intervention that I want to mention varies from patient to patient. Some patient body is different from other. So based on whatever work for you, go for it. And most sickle cell patients, they have their their crisis intervention plan that they have aside, that okay, if it happens, this is what I'm gonna do. But I just want to emphasize and said, okay, you can do this, that will enhance the management of the crisis. Okay, so let's take warm compressor. Yeah, they have bottled water that you can warm water and pour it on. It's in Target, Walmart, CVS, name all this store. You can just buy. You don't have to break the bank. It's cheap. Pour the water, put towel, warm towel, and wrap it around. Place it to exact place that is hurting you. Most of them, they complain about chest pain, they complain about back, leg, whatever area that is hurting the patient. Just put the warm compressor. Some patients prefer cold compressor too, but mostly warm helps them because it dilates their vein and it reduces the pain. So make sure as a parent, if you have a child or you have children with sickle cell crisis, warm water bottle is the key. Just put it to wherever it hurts them so they can feel relief. Drink a lot of water to prevent dehydration, especially during summertime when it's hot. When it's hot, make sure they drink a lot of water, they are hydrated, as tolerated. Yeah, but mostly water. They can drink other juice too, like juice, but avoid carbonated drink. Just drink like juice, apple juice, orange juice, all those juice. But mostly water. Let it contain mostly water so it can dilate their system very well. And also it can prevent constipation because they use all the strong medication, so they will get constipated often. So they need water also to prevent constipation or UTI, urinary tract infection. The next one is pain management, anti-inflammatory pain management. I don't like to mention that, but as per your doctor recommendation, whatever the doctor order for the child, give it to him or her so that that pain can be reduced. In addition to the pain medication, those are the interventions that you can add to it. But the key thing is make sure you give the pain medication as per the doctor's order immediately so the child can feel relief and they can go by their daily activities. Okay, so I'm about to do part 2. Don't go. Stay tuned to my channel. You want to see part 2 of how to manage sickle cell crisis for those who have sickle cell children, okay, or wife. Okay, now let's go to part 2. Stay tuned.